Good afternoon, everybody. And from wherever you are around the world, good morning and good evening. Welcome to our Science from Your Sofa webinar. I'm Amy Lietman, your moderator, president of NTM Info and Research. Today's topic is why, how, when, Aerobika, AeroClips, and AeroChamber. We'd like to welcome our speakers today. Judy Shalos is based out of Minnesota and is the clinical care manager for Monaghan Medical. She brings more than 25 years of experience as a respiratory therapist in academic medicine along with her today. Chris Patrick is the marketing manager with Monaghan Medical Corporation and has been with the Trudell group of companies for over 15 years. Chris works out of the Canadian head office for Trudell, where she is able to work closely with the product development teams who work to bring new products to market. She was involved in the development of the reusable Aero Eclipse Nebulizer as well as the Aerobika device, and a few years ago transitioned to the role with the US team at Monaghan. She is usually more behind the scenes, but looks forward to today's presentation. David Sidor is the product manager of the Aerobika OPEP device for Trudell Medical International. He is based out of Canada, but his work with OPEP covers the entire global market with the exception of the US. For this, he works closely with Monaghan Medical to understand and align market needs. Welcome and thank you all for being with us today. Today, during the presentation, you'll be able to drop your questions into the Q&A box. Once you've typed your question in, you hit send, and the question will appear in the queue. Once the presentation is concluded, I'll start reading the questions out loud for the presenters to answer. You can also hit that send anonymously box in the corner to ask your question anonymously. We'd like to thank all our generous supporters. Without support from companies like Insmed and people like you, we could not continue to bring the wonderful programming that we do, and we really appreciate your support. Don't forget to find us on social media. You can find us on Instagram, Facebook, Twitter, and LinkedIn. Learn more and sign up for the latest news at ntminfoandresearch.org. And if you haven't seen all of our previous webinars, you can catch up on the latest ones on our YouTube channel, youtube.com/NTMIR. Thank you for coming. We appreciate you being with us today. The floor is yours.
Brief. We want to talk to you about how the device works, how to use the device, and the recommendations for cleaning of each of the devices. And so after we finish that brief presentation, we'll open it up to question and answers. And as Amy said, you can just pop your questions in. One thing to keep in mind while you're listening to this presentation and entering your questions in is that even though Trudell Medical and Monaghan Medical are sister companies, we fall under the same umbrella, and we handle the exact same products, especially those that we're going to talk about today. We each have different rules and regulations that we need to follow for the countries that we serve. And so it would be extremely helpful to us when you are popping in a question to either let us know where you're located or let us know what company is going to service you. So Monaghan Medical will only service the United States, whereas Trudell Medical will service Canada and a farther global reach, any other countries out there. So with that, I'm going to turn it over to my colleague, David Sidor, who is going to kick off this webinar with the AeroChamber.
Awesome. Thanks, Judy. So the AeroChamber plus FlowView valved holding chamber is used in combination with an inhaler to deliver medication. Its purpose is really threefold in that it can help with improving medication delivery and deposition in the lungs, overcoming inhaler coordination issues, and reducing inhaler side effects. So the AeroChamber device, what it does is it slows down the medication that's released from the inhaler and holds that medication suspended in the chamber. And this allows people more time to breathe in the inhaler medication, and it allows them to do so at their own pace. And this can be really helpful if in ever case somebody feels out of breath and they may be struggling to inhale deeply in the moment. The AeroChamber helps to accommodate this so that they can inhale at their own pace. And this is really key for coordination, as the majority of inhaler users actually have incorrect or poor inhaler technique. And that's usually from the actuation of the inhaler to the inhalation of the medication. So using the AeroChamber helps to ensure that your medicine reaches your lungs where it's needed most, and it limits the amount that ends up in the back of your throat or in your mouth, which can lead to irritation and other side effects.
Judy is going to demonstrate how we will use the AeroChamber Plus FlowView product. So the first thing you're going to do is remove the mouthpiece cap from both your inhaler and from the chamber if you're using a mouthpiece chamber. You'll then shake the inhaler vigorously before you insert it into the back piece of the chamber. And when you put the back piece, or when you put the inhaler in the back piece of the chamber, it's going to position it correctly as long as you push it in all the way. If you leave it out a little bit, what can happen is the inhaler can angle slightly and the medication will impact on the side of the chamber instead of being released into the center of the chamber. So push that inhaler in all of the way. You're then going to seal your lips around the mouthpiece. And if you're using a mask product, you're going to want to make sure that the mask seals all the way around above your nose and down under your chin. You don't want outside air to be entrained while you're breathing your medication in, because that's going to dilute what you receive. So Judy's going to seal her lips around the mouthpiece of the chamber and just inhale and exhale normally. And then at the beginning of a large, deeper inhalation, she's going to press the inhaler to release the medication into the chamber. And then she's going to take a deep breath in and hold her breath for 2 to 3 seconds before she exhales. And that allows the medication particles to settle in your lungs. However, if you're not able to take a large, deep inhalation and hold your breath for that time, what you can do is 2 to 3 regular tidal breaths through the chamber, just inhaling and exhaling to ensure that you get all of the medication that's contained in the chamber.
If you are taking your breath in and you're taking it in too fast, these chambers will alert you to slow your breathing down, and it will sound like this. And that's to get you to slow that inhalation down so that the medication will settle deep and evenly in your lungs and not impact the back of your throat.
The other thing that's important to know is if you are prescribed 2 puffs of your medication, you don't want to put them in the chamber at the same time. You want to complete each inhalation separately and wait for about 20 to 30 seconds between puffs. You never want to put more than 1 puff of medication into the chamber at one time.
So I'm going to review how to clean your AeroChamber. And it's very simple. The mouthpiece opens just like a regular jar, and you can separate that. And the back piece has to peel off from the chamber and should look just like this. All 3 of these pieces can be soaked in warm soapy water and then rinsed and shake off the excess water and dry them vertically on a surface. You can also put these in the top rack of the dishwasher, but we do not recommend the drying cycle on this. So after it's washed in that cycle, you can take it off. Again, if there's excess water, you just shake it off and dry them in an upright position. When you go to reassemble the device, all you have to do is line up the notches and do that half turn, and the back will line up as well. There's a notch in here that matches with a notch on the blue silicone, and it just pushes together so that it will line up the meter dose inhaler directly with the mouthpiece.
So now we're going to talk about the AeroEclipse Xl reusable nebulizer and the Umbra compressors. So the AeroEclipse XL is a nebulizer. And what that is going to do is take medication that's been prescribed as a liquid and convert it into an aerosol so that you can inhale it into your lungs where it's needed to target the receptors. In order to, well, first I'll explain what makes the AeroEclipse a little bit different. AeroEclipse is a breath-actuated nebulizer. So what that means is that it is only going to create aerosol when you're inhaling. So most continuous output nebulizers are going to create aerosol all the time, from the time you turn the compressor on until the time you turn the compressor off. Whether you're inhaling or not, the medication is getting released into the environment. With the AeroEclipse in breath-actuated mode, it's only going to create aerosol when you're inhaling. So that avoids wasting expensive medication, and it also helps protect the people who are in the room around you from having to inhale medication that's released into the environment between breaths or while you're taking a break in treatment. So to use the AeroEclipse with a compressor, the first thing you're going to do is take the tubing and attach, oh, okay. First, we're going to prepare your nebulizer cup. So you're going to remove the top from the nebulizer by turning it a quarter turn counterclockwise, and then just remove the top. You're going to place the liquid medication into the cup, and then you're going to reassemble the top to the bottom of the nebulizer, making sure the white cylinder goes around the post at the bottom of the cup. Then you're going to do a quarter turn counterclockwise, and it's going to stop. You can't over tighten the top. And then your nebulizer is loaded and ready to go. Then you're going to take the tubing that one side is connected to your compressor, and the other side you're going to connect to the bottom of the nebulizer, making sure that you don't tilt the nebulizer cup too far and spill the medication that you've placed inside. Then you're going to be in a comfortably seated position. You're going to turn your compressor on and place the mouthpiece in your mouth. You're just going to inhale and exhale through the device with aerosol being created on your inhalation and aerosol stopping when you're exhaling. And there's a green button on the top of the nebulizer that you can use to help coach you through your breath. You want to, as you breathe in, the green button is going to drop, and you want to keep that button down for as long as you can. Then as you stop inhaling, or if you take the nebulizer out of your mouth, the green button is going to rise back up and aerosol will stop. While you're taking your treatment, you're going to breathe in and out, just normal tidal breathing. And the device, once you get to the end of your medication, will start making sort of a sputtering noise. And that means that you've taken the treatment as far as you can. So then you turn your compressor off. And on the screen here, you'll see the top of the AeroEclipse. And when we're talking about breath actuated mode, that mode selector is going to be turned to the triangle that is composed of small dots. So that is the mode that it should be in for the majority of your treatments. However, if you're having a hard time and you're taking a rescue medication, you can turn it to continuous mode, which will create aerosol continuously. But again, we would recommend that you use the device in breath actuated mode so that you can get the most out of your treatment. To clean the AeroEclipse, you're going to make sure that it's in breath actuated mode at all times when you're cleaning. Then you're going to disassemble it into 3 pieces. So you'll remove the mouthpiece, you'll remove the nebulizer top, and you'll wash these 3 pieces in either soap and water or on the top rack of the dishwasher. And for this device, you may want to use a dishwasher basket to contain the pieces, because the water jets can toss them around inside the machine. So top rack of your dishwasher, and as Judy mentioned with the AeroChamber cleaning, you don't want to use that drying cycle on your dishwasher with any of our devices. The temperatures inside the dishwasher just get too hot for the materials. And so if there's a little bit of water remaining on them when you take them out, just shake them off and put them on the counter to finish drying. Don't reassemble your device until it is completely dry. For the AeroEclipse, you're going to disinfect the device every other treatment day. And this may differ depending on the disease state or the type of treatment that you're taking. Your clinician is going to have the best recommendation for you for how often to clean your devices. So if they say it needs to be cleaned and disinfected after every treatment, then that's what you need to do. These are just our recommended cleaning methods, but you should always follow the instructions of your healthcare professional. And the AeroEclipse reusable, and you'll know it's the reusable version because it's got a green tint. So if you're in the hospital and you receive a clear version, that clear version is a disposable device, and it's only really good for 7 days. But the one that you can use for up to 6 months is tinted green, and it can be boiled for up to 15 minutes. You can use an electronic steam bag or an electronic steam sterilizer, like a baby bottle sterilizer, or a microwave steam bag, according to the manufacturer's instructions. And then I'm going to turn it over to David to talk to you about the Aerobika device.
Great. So the Aerobika OPEP device, or for long form, the Aerobika Oscillating Positive Expiratory Pressure device, is used to help open patients' airways and to help loosen and clear excess sticky mucus from the airways, which will then ultimately help to further open up that respiratory tract. So if we look at the image in the bottom left of the screen here, this illustrates what a person with bronchiectasis or NTM or even COPD, what their airways may look like before a treatment. So these airways are inflamed, they're constricted, they may be collapsed, there may be some scarring, and they're filled with this thick, sticky, excess amount of mucus. But it's important to note here that mucus is a normal, healthy body response, normally, and the ideal amount. So it's designed to line the airways and trap foreign particles so that our bodies can remove these, so collect and trap those foreign particles. That's a normal response. However, when we have too much of this mucus, especially sticky mucus, it becomes really difficult for our bodies to clear it. And this can lead to that mucus staying static in our airways, which leads to fostering bacterial and viral growth that we may breathe in. And when these bacteria and viruses grow in the mucus, it can lead to further infection. And then this infection can cause inflammation. And what ends up happening is it creates this vicious cycle. And that's what we want to break here. So the Aerobika can be really helpful in this regard. When you use the Aerobika device, as you exhale through it, there's pulses of resistance that create positive pressure in our lungs. And this helps to open the airways. And at the same time as this, these pulses create vibrations or oscillations, as in the name, which act to loosen that mucus and help to shear it from our respiratory tract, moving it from the smaller airways to the larger airways where it can then be coughed out and cleared out. And by clearing this excess mucus, you're better able to open up those airways even further, which then may allow additional therapies such as inhaled medications to reach your lungs more easily and therefore work better. Next slide. Perfect. So the Aerobika OPEP device can also be used with a manometer accessory or a manometer adapter. And this manometer adapter acts as an indicator of user expiratory pressure. So essentially, if we look at the manometer gauge, which is in that circle there on the right-hand side, there are 3 pressure zones. There's a green, a yellow, and a red zone. And these correspond to different degrees of exhalation pressure. So for each exhalation effort or each breath out, the goal is to keep that indicator within that green zone. And this will help to maximize treatment effectiveness. So essentially what this means is that when you exhale, there's an indicator inside or a little plunger, which will move depending on how much force you breathe out. So if you breathe out with too much force and the indicator moves up into that yellow or even into that red zone, this provides a visual feedback that basically says, oh, I'm exhaling too forcefully, I need to ease back a little, otherwise I may not be achieving that optimal therapeutic benefit. But it's also really important to note here that although the manometer is handy and it's helpful, it's not needed for the Aerobika to function. So the Aerobika on its own without the manometer works entirely fine. So you don't need that manometer, it's just an add-on. And the benefit with it being an add-on is really that immediate feedback, which can help people that are unfamiliar with proper breathing technique to become more accustomed to it and used to it. But it can also serve as a helpful reminder even for seasoned users of the Aerobika. So that's essentially what the manometer is. And with the Aerobika as well, there's a resistance setting feature. So on the Aerobika OPEP device, there are 5 resistance settings, which can be used to adjust to the user's capacity. So in the bottom right of the screen, you'll see there are 5 settings. And as you move to the left or towards that number 5, you experience greater resistances. And then oppositely, moving to the right or towards that number 1 will lessen that resistance. Out of the package, it's often set to resistance level 3, the middle resistance. However, the device resistance setting should be set up in consultation with your healthcare professional. So your physician or whoever your healthcare professional may be should customize this resistance setting to your specific needs. And a really important thing here with the resistance setting is that higher does not mean better. We really want to maximize the treatment effectiveness, and this is not achieved by just sliding it to the highest setting. We want long, active exhalations that are performed at the appropriate resistance level to the user, and this is superior to short and fatigued exhalations that may occur if the resistance is set too high. And I think in a couple slides, we have a few clips that we can play for you where you can really hear the difference between what the Aerobika device should sound like when it's used at the correct or appropriate resistance versus when that resistance is set too high. So there can even be a little bit of an audible cue there.
I think I will add on to that as well as sometimes once you have your resistance chosen or set for you, it's important to really pay attention when you're using it, because as your symptoms change from days to day or week to week, you may need to adjust it based on a lot of the signs that we'll share with you in a little bit. So don't set it and forget it. If it's fatiguing you, you need to change your resistance, step it down, or work it up as your symptoms are changing.
Exactly. Next slide, if you don't mind, Chris. Perfect. So now that we've introduced the Aerobika device and the benefits that it has, I want to go over how to use it. So you would start by looking at your device, and you want to perform a visual inspection before you actually use it. So looking in the mouthpiece, looking in the back inhalation ports, You want to make sure there's no dust or debris or anything in the device that you wouldn't want to inhale. You also want to make sure that your resistance is set as prescribed, and for some reason it's not on an incorrect setting. And you want to make sure that the top half and the bottom half are securely engaged, especially if you've recently taken it apart for cleaning or disinfection. But after you've checked all of that and everything is good, you can close your lips around the mouthpiece. You want to make sure your hand isn't blocking the two back exhalation ports, which is where the air comes out of the device. So make sure those aren't blocked by your hands. And if it's not blocked, then inhale through the device. You want to take a deep breath, but not to your full lung capacity. And if you can, try and hold this breath for 2 to 3 seconds. But if you can't, then don't force yourself. Following that, you'll want to then exhale slowly and firmly. But remember from when we talked about the manometer, you don't want to exhale too forcefully. So if you're using a manometer, you want to be in that green zone when you're exhaling. And generally, a way you can think of it is that if you're exhaling so forcefully that your cheeks are inflating, like you're exhaling too hard, you want to try and keep those cheeks flat. And when you're exhaling, this should be about 3 to 4 times longer than your inhalation was. So that's sort of an important ratio. Exhalation of 3 to 4 times longer than your inhalation. And so you'll continue this cycle of inhaling, holding if you can, and then exhaling for about 10 to 20 breaths, or as instructed by your healthcare professional. And then you'll perform a huff cough or a series of huff coughs to help clear your airways, as using the device will often bring up some of those mucus secretions, so you can cough to clear those out. And then you're going to repeat all of that cycle for about 10 to 20 minutes, for about 1 to 2 times a day, or as prescribed by your healthcare provider, but that may increase depending on how much mucus you are producing. So there is variable in terms of the daily usage, but that's usually determined in consultation with your physician or healthcare provider.
So as David mentioned, we're now going to play short videos. The technology in Zoom sort of cuts out the noise from the Aerobika device. So Judy was kind enough to record herself using 3 different types of technique. So the first is the correct exhalation technique. And some of the things that you're going to notice is that there's a very consistent oscillation sound coming from the device. You're going to notice that the red plunger in the manometer gauge is always in the green zone, and it's maintained at a relatively similar levels throughout her exhalation effort. And you're going to also notice that she keeps her cheeks flat and firm, that they don't puff out like David referred to. So we'll play this first clip. If you have your resistance set too high, what you're going to find is that you have to take a much less forceful exhalation, because it's going to make you tired or get lightheaded. It can sometimes. So this is when the resistance is set too high, and you need to reduce the resistance in order to enable that long, slow exhalation effort. So here it is when the resistance is set too high. And what you may have also noticed there is that you didn't see the red plunger in the manometer gauge at all. And so that means that the pressure that you're achieving is very low. And so you want to remove that resistance and try again. On the flip side, if you are exhaling too forcefully, you're going to see the manometer gauge go into that yellow and red zone, and you're also going to hear a very strange noise come out of the device. So this is what it might sound like if your exhalation is too forceful. So you definitely want to slow down your exhalation and maybe increase the resistance a little bit if you're hearing an exhalation like that. When you're cleaning the device, you're going to take it apart into its 4 pieces. So you'll remove the mouthpiece, you will remove the top case from the device, and you will also remove the cartridge that's inside. The cartridge does not get disassembled any further than this. That is how you will wash it. You can put the 4 pieces in soap and water and soak them for about 15 minutes. Or again, you can use the top rack of your dishwasher, and this is another place where that dishwasher basket is going to come in handy. You should clean the device after each use, depending on what your healthcare team, depending on your condition and what your healthcare team recommends. They may recommend different cleaning frequency. Again, these are just the instructions that we have in our instructions for use. And so you should always follow the recommendation of your clinical team. For disinfecting are recommended, so this is actually where we differ in the United States and in Canada. Disinfection should be every, well, you can do it weekly or you can do it daily. Again, at the recommendation of your clinical team. If you are in Canada or the rest of the world, you can use an electronic baby bottle sterilizer in order to disinfect your Aerobika device. That is not included in the United States instructions. That is considered by the FDA to be off-label use. And so you won't find that type of disinfection in the US instructions. But the remainder are exactly the same. So you can boil the 4 pieces for 5 minutes. You can put it in isopropyl alcohol for 5 minutes, or hydrogen peroxide for a half hour. Or again, you can use that microwave steam bag according to the manufacturer's instructions. One of the things you're also going to do is you're going to want to soak your Aerobika device, all 4 parts, in a solution of warm water, 1 cup of warm water, 1 cup of vinegar for 1 hour. And you want to do this every month. And what that's going to do is it's going to remove some of the mineral deposits from our city tap water from building up on the very small pieces within the cartridge of the Aerobika device. And I also want to remind everybody that the Aerobika device is good for 12 months of continuous use. So if you do run into challenges with your device before that period of time is up, we encourage you to contact our customer service team in order to make sure that if you have a defective device, then it should come back to us. That it's highly unlikely that they get out of our warehouse that way, but it can happen. And so contact them if you're within that 12-month period to make sure that we can get you a replacement device.
To add on to that, Chris, I think it's important to know that when you are done, these devices need to air dry. If you put anything into this working component of the Aerobika, you can dislodge pieces and the fluttering will stop. The biggest culprit is this green piece on the bottom, can easily get hooked if you put a towel or a dishcloth in that. And once that is unseated, the fluttering will not work. It's easy to put it back together and reseat it, but that's one of the biggest errors that we hear from customer service is that you've dislodged this. and then it won't work. So, and then putting the device back together again is very simple. It only goes together one way. And again, only put the device back together after it has been thoroughly air dried. So I'm going to talk about combining therapies with your Aerobica and your nebulizer. Because we make the AeroClips, that's what I'm going to talk about. So putting the devices together, they've been designed to be used together. And so all you have to do is remove the mouthpiece from the AeroEclipse. Now, you know it's the AeroEclipse mouthpiece because there is a green valve on there to exhale, and the Aerobica does not have that. So you need to take that mouthpiece off, and you would connect it to the back of the device, preferably use it in the breath actuated mode. And when I say that they were designed to work together, when you take a breath in, you will get medication, and it comes directly from the nebulizer straight across into your lungs. When you exhale, it goes a different pathway down and around through the device and out these two little ports on the back. It does not come out the big port right here. So the flow pathway in goes this way, the flow path out goes down and around and out. And so that's how we know that you can get the same amount of medication by doing your nebulizer alone or your Aerobica alone. Some people do not like to breathe in through their devices, especially those of you with NTM or not just with bronchiectasis. And you can certainly do combination care. What we hear is that people will inhale this way and exhale this way. And that's acceptable as well. It just goes together so nicely with the both products if you can. And again, using it in breath actuated saves the medication from going all over into the room and saves the majority of it so that it can go into your lungs where it can do the most benefit and have the best results for you. So you can save time and have the same outcomes by combining the two of them together. You can also do it with the manometer on the device as well. So it would still look like this with your Aero Eclipse on the back if you have the manometer. So lastly is just one study that was done with a scan, and it looked at how much medication gets into somebody's lungs if they're doing just the Aero Eclipse alone or with it combined onto the Aerobica device. I lost my mouthpiece. But as you can see, medication alone with the nebulizer is the same as when you put them together. And so it should reassure you that this disease, these treatment plans can take a lot of your time, and this is one way to save a little bit of time in your day with therapy.
And there's a couple of medications that you would want to do and a couple that you wouldn't. Do you want to talk about that, Judy?
Yep. Thanks, Chris. I forgot to mention that. So anytime you are putting medications through your Aerobica, it's absolutely okay. Your bronchodilators can go through there, your hypertonic can go through there, even your steroids can go through your Aerobica. Any of the medications like your antibiotics, if you're taking any of those drugs need to sit in your lungs to do the most benefit. So those are medications we like to save for the end and not use in combination with your Aerobica. So we would ask you to just do the nebulizer alone so that the medication stays in your lungs as long as possible to kill as many of the bugs that it can. So it does the most amount of work.
And I know Judy touched on it. The Aero Eclipse nebulizer does have that green exhalation valve on the bottom. You want to make sure that you're using your Aerobika mouthpiece when you're doing combination treatments. If you use your AeroEclipse mouthpiece with the Aerobika, what's going to happen is instead of the exhaled flow getting directed through the device, it's going to be directed in front of the device. So you want to use that solid mouthpiece anytime you're using your Aerobika device, even if you're using it in combination with your nebulizer. So now we're going to open the floor to the question and answers. I see that there are quite a number of questions, so let's jump right into it. I'm going to stop sharing.
Yes, and I will tell you that we can repeat any of the demonstrations on the big screen too, if that would be beneficial to you.
There are quite a number of questions, so let's get started. How often should you change your device?
So this is going to depend on the device that you're talking about. Since it was close to the beginning of the presentation, I'm going to assume that they were talking about either the AeroChamber or the Aero Eclipse. The AeroChamber device should be replaced every 12 months use, whether it's a mouthpiece or a mask. The Aero Eclipse XL nebulizer should be replaced after 6 months of use, and the Aerobica device should be replaced after 12 months of use. So the chamber and the Aerobica are 12 months, and the nebulizer is 6 months.
You do have a little bit of wiggle room if you have more than one device. So if you alternate between 2 Aerobicas, or if you're lucky 4 Aerobicas, that time frame kind of lengthens out a little bit because you're not using it consistently, not cleaning it consistently day in, day out.
Okay. We who have NTM have to take extraordinary measures to disinfect our device. For example, we typically would boil the Aerobica for 10 minutes, often daily, or we might steam the device either in a mechanical steamer or via a microwave bag. Given this level of wear and tear on the Aerobica, how frequently would you recommend replacing it?
Chris,
yeah, so the Aerobica device, when we were doing the development work, we were really thinking about who the most vigorous cleaners are going to be. And so we have made sure that the Aerobica device can withstand any of our disinfection methods for the full 12 months. So if you need to disinfect it every day, then that's fine. It's still good for the 12 months. We do recommend that monthly soak so that you can remove any of the mineral deposits that can build up during the boiling process. And when you're doing that, 1 cup of warm water, 1 cup of vinegar for 1 hour, that is before you would clean and disinfect the device. So it's not a cleaning method itself. It's simply meant to help remove some of the sediment that could build up on the silicone parts inside the device.
Okay, so the AeroChamber, you could boil that for 10 minutes?
No, the AeroChamber can only be hand washed or put in the dishwasher. There are no disinfection methods for the AeroChamber device.
Okay.
Yes.
We have a couple of questions about the Aerobica and a gagging feeling or effect that people are getting. They're asking, one person's asking, is it similar to an asthmatic feeling? And if so, what does it mean and what should you do? And somebody else is asking, how might you lessen that gagging effect when you're using the Aerobica?
That's a tough one. I've had one patient in the past who had a similar, and it just took time of using it to minimize it. It's the vibration hitting in the upper airway that causes that feeling. And I would suggest adjusting your resistance to find a comfortable level, like moving it down a little bit and then working back up to a level that is tolerable for you, and see if that is helpful to you. But I don't know of any other techniques. We can ask in the community and then get back to Amy on that. But that is the only thing that I know that might lessen that a little bit.
Okay. Oh, hang on. People keep popping in questions and it keeps bouncing. To follow up on that, on a question about microwaving, how long would you microwave steam the Aerobica to kill the NTM? Do you have any recommendations on that?
So I can jump.
Okay.
Oh, sorry. Yeah, I can jump in, Chris. So it really depends on sort of the manufacturer's instructions there, because it can vary. We can't really provide sort of a standard answer that will be applicable to everybody's situation. So unless Judy or Chris, you have anything to add, best would be sort of reference the manufacturer's instructions there for the microwave steam bag and follow that.
Yeah, because it depends on the power of your microwave as well.
Okay. Since it is only breath actuated, does one use smaller quantities of the medication? If not, would they not receive a larger dosage of delivered medication compared to using a non-breath actuated device?
You know, that's a really common question that we get. And we certainly don't want you making changes to the amount of medication that you put in the cup. When the AeroEclipse is powered with a compressor at home, you're going to receive probably the same amount of medication that you would have received from your other nebulizer, just a little bit faster. So, Judy, do you have any recommendations for that?
No, with the compressor, it's less of an issue than it is in the hospital off a wall air or oxygen. But what we have seen, even in children, is that the dose, the more deposited in your lungs, gives you less side effects because less is going into the back of your throat and being swallowed, going systemic or throughout your body. It's going onto your lungs. And so you only have so many receptors on your lungs that can take the medication in. And so once they're full, if they're full, it doesn't harm.
Okay. What happens if you keep inhaling after a sputter noise starts?
Nothing. So sputtering is just your auditory cue that the nebulizer volume is coming to an end. And so, especially if you're using it in breath actuation, you've gotten the full amount of your dose and you can close it off. I have had patients over the years that tap their nebulizer to bring the droplets down so it will nebulize longer, and that's okay too. That is something that started with the first generation of T-piece nebulizers that were really inefficient, and so not a lot of medication, not as much medication can get into your lungs with those kind of nebulizers. So patients felt if they tapped on it more, they would have access to more. And you can do that as well. It's not necessary with the AeroClips.
Okay. Somebody is commenting they've never heard a fluttering noise when they use the Aerobica. Can you comment on why that might be?
So there's a couple of things that could be happening there. One of them is what Judy was explaining, that maybe during cleaning, the green silicone on the bottom has become pushed in. So you want to make sure that it's flat with the bottom of the cartridge and that it's not pushed in. The other thing is that they need to check and make sure that they're using the solid white mouthpiece that comes with the Aerobika device and not the green valved mouthpiece that comes with the Aero Eclipse. So if you're using the valved mouthpiece, it is not going to direct air in and through the device. The other challenge that could be happening is that maybe it's not fully latched. So if the front is still sitting a little bit outside, you want to make sure to press those top and bottom cases together to make sure that it's sealed.
The other trick I would try as well is pull your resistance all the way to 1. And sometimes if you have shallow breathing, you might not be able to engage the flutter at all. You can always call customer service and we can analyze and make sure that it's not the device or not your technique, and get you situated.
Okay. Does the water in soap and water have to be sterile?
Not always. I will. In general, it does not. In this community, it's beneficial, I think, for you to mitigate any risks that you have with water. So if you can use sterile water, I know that it can be costly. It's time consuming to boil the water that you're going to use to boil your equipment, but any precautions that you can take to decrease the mycobacterium that can be in your water supply is going to be beneficial to you so that you don't reinfect.
Okay. Is the treatment time-based, like 20 minutes or whatever, or however long, or is it until all the medication is gone?
I'm assuming they're talking about combination therapy there. So the combination therapy, you can continue doing the therapy for the 10 to 20 minutes. Your nebulizer may complete before then. And then you can simply remove it from the back and finish your breathing treatment through the Aerobika device.
Okay. If you're using the device twice a day, are you supposed to clean it with soap and water twice a day, or is just water okay?
For the Aerobika, you can, again, it depends. You can clean it once daily if you want. So you don't necessarily have to clean in the morning and afternoon. You could just clean at the end of the day with soap and water then. But if you are worried about infection and you want to be sort of the most cautious you could be, it would be, you likely want to clean with soap and water after each use, as well as disinfecting once a day if need be, or once a week if less concerned with infection.
Can you use an Instant Pot as a steamer?
Ooh, so I'm going to say no. We have not tested that as a method of cleaning. So it's very different than a regular steamer because it's pressurized. So I'm going to have to say that we would need to test that in order to make sure it doesn't damage the device.
Okay.
I do know that people boil in the Instapot, right?
That's not pressurized though. So.
Yeah.
Okay. Somebody has a question about the green tint I guess, on their device. They can't tell if there's a clear or tinted green. Is it just that it's a very slight tint, or are there two different?
So it is a very slight tint, and it's harder to see on the camera than it is
Got it.
side by side. But the disposable one that is good for 1 week of use, you can see right through it, whereas the green has a cloudier appearance. So you can't directly see through it, and it does have a hinge of green to it. So these are the two side by side, but again, I can see on the camera that it's difficult to see.
Yes, I can see the difference in terms of the cloudiness, though, on the camera. So thank you. That's a very helpful illustration. I use alcohol to sterilize my Aerobika, soaking it submerged for an hour or two. Is that okay?
You can disinfect the Aerobika with isopropyl alcohol, 70% concentration, although we recommend for 5 minutes to soak in the alcohol and then to rinse thoroughly with distilled water. Chris or Judy, would you know if there'd be any impact on the device for soaking longer than the suggested 5 minutes?
You know, that's another question that we're going to have to take back to our engineering team. I think every once in a while, if you forgot it in the alcohol, that wouldn't be a problem. But over time, I'm not sure what would happen. It shouldn't, but we'll get back to Amy with an answer for that for a longer term alcohol soak.
Thank you. How long should it take to inhale 7% saline using an AeroClipse XL connected to an Aerobika? Is there, or would that depend on how much saline you're using?
Yeah, you know what? That's a really tricky question because it depends on the saline fill volume that you're using. And the other thing is going to depend on how deeply you're inhaling and how long you're keeping that green feedback button down on the AeroEclipse. A normal treatment with 3 milliliter fill driven by compressor should take somewhere between 8 and 10 minutes. But you're also doing your OPEP treatment, which is a longer, more active exhalation. So it could extend it out past that period of time.
Okay, thank you. Can the AeroClips be positioned between breath activated and fully open?
It cannot. There is a detent. There is a detent between the two settings, but if you just place it in the middle, it would still be in breath actuated mode.
Okay.
But you can flip back and forth in between therapy, you know, just by turning it one or the other. So you don't have to set it just in continuous or just in breath actuated for your entire treatment. You can toggle it back and forth.
Okay. We have a lot of questions about the Manometer Adapter. A lot of people would like to know, where can they get one? Some people don't have one, or they don't see one on their device. So, and some people have the device, they don't have one with it. Can they acquire just the manometer, and where?
So that's going to be country specific. In the United States, the manometer accessory only comes packaged with an Aerobika device, so you can't buy it separately. But if your device didn't come with one and it just looks like this, it's still just fine. We used the manometer accessory today on the video so that you could see what was happening as Judy was exhaling. It just makes it easier for the visual, but the Aerobika device still works just fine without a manometer adapter. If you wanted to purchase a device with a manometer accessory in the United States, I would have you contact our customer service department, and they would be able to direct you to a location in your state that you would be able to get one.
The Manometer Adapter and the Aerobica, either or both, is prescription only in the United States. And that's not us doing that. Those are the regulations we were talking about. We have to follow through with that, and somebody way above us has decided that this is a prescription product. So to get the Aerobica with the manometer, physician order has to be written in that way to get that device.
Okay. And the manometer, if you have one, can it be switched out when you get a new Aerobica? Can you switch it out to a new Aerobica unit?
You can. Oh, go ahead, David. Go ahead.
I was just going to say, yeah, as you can, as Judy mentioned, although it does also have a replacement date, it is actually slightly shorter. It's about 6 months. So if you are receiving the Aerobica and the manometer at the same time, it's unlikely you'll be replacing your Aerobica before the manometer. That's the only thing. But I mean, otherwise, it could potentially be switched onto a new Aerobica. It all depends on the specific case.
Right. So the manometer has a 6-month lifespan because this is a measurement tool. And so to guarantee accuracy, it can only be done for 6 months. And I'm going to jump in. I know this is not a question, but if you have a manometer and you're looking at cleaning this device, this piece right here can be boiled just like your Aerobica, but the manometer itself has to be detached from this, and this can only be wiped down. It is a closed area, so no airflow is coming in or out that could reinfect your lungs. But again, because it is a measurement tool, water cannot get in there. It would affect the measurement accuracy. So this can be boiled with your Aerobica. Just take this off and wipe it down with isopropyl alcohol.
Okay. Thank you. I think we have a couple of questions further down the list about manometers, and we'll get to those. What type of illness requires level 5 setting on the Aerobica?
I'll jump in and take this. It's not the illness. So it is your lung capacity, what you're capable of doing. So early stage lung disease, and I'm talking general. So an early diagnosis of COPD, early bronchiectasis, anything that needs early cystic fibrosis, but you still have a lot of lung capacity, you could probably tolerate a level 5. And as your lung changes, as your endurance changes, it's based on a lot of different things, but it's what works for you. And David said it best earlier, the higher number doesn't mean a better treatment. It is just to cover a range, so it works for a majority of patients. And we just want you to find the right range for you and be able to kind of adjust one up or one down based on your symptoms so that you get optimal treatment every time you use the device.
Okay. Somebody's asking about migraines. They say that since they started using the device, they've had more migraines and they felt lightheaded. Have you heard of this before?
Not heard about migraines, but we do address the lightheadedness with everything we do, from the nebulizer to the Aerobica use. And some of the lightheadedness comes from just taking the bigger deeper breaths more than average, you almost are kind of hyperventilating. And so if that's happening, we would ask you to pause your treatment or slow down the breathing. And so instead of doing 10 to 15 breaths, maybe do 5 breaths through your Aerobica, take a break, and then continue on for a longer period of time. If you get lightheaded through any of this therapy, you need to stop and take a break. Let your body, let your lungs equilibrate, and then you can restart it. And I don't know about the migraine. I've never had that correlation before.
Yeah, I would suggest to this person that with respect to migraines, you speak to your physician about that one.
Yep.
Can you demonstrate a huff cough?
I can. I came from the University of Minnesota with the pleasure of working with Dr. Warren Warwick, who was a pioneer in CF medicine. So he taught me how to have cough, which I will gladly share with you. I don't think I can get my chair back far enough, but I'm going to turn to the side. And if you can sit upright and put your hands on your knees, and what you would want to do is take your breath in and huff. So huffing moves secretions without tiring out your body. So instead of coughing like this, huffing, you're not going to close the glottis in the back of your throat, so it sounds like a huff, and some people actually say huff. So it should be kind of like if you were going to fog a mirror and you breathe down it like that. That's what a huff cough is. So if you can put your hands on your knees, take your breath in, and then you would huff like that, so that you're not coughing, you're just moving air in a faster motion without closing down the glottis. I'll do it one more time. Does that make sense to everybody? And you want to use your body too, because you can take your breath in and huff and kind of bend over with it.
Okay. Moving back up to the list. Okay, let's talk about results for a minute. We've had a few questions. What do you recommend for people who are using their airway clearance device like an Aerobica, and they're not hearing anything in their airways, they're not really producing any sputum? And let me preface this by saying that some of the physicians that we have worked with in the past who've given presentations on airway clearance have said that you should continue to do your airway clearance daily, because even if you're not bringing something up, you're moving it around in your lungs and it helps. And sometimes you're not aware of, maybe that mucus coming up and clearing out, down your throat.
That's absolutely the case with that. And remember, David went through, the Aerobica is twofold. So it does shake the lungs and can bring the secretions up, but that pressure that's in there also is going to reopen areas of collapse that may be caused because of secretions, but maybe not. So even doing your airway clearance where you don't feel like you're bringing up a lot of secretions, you are still benefiting your overall lung health and hygiene.
Okay. Question about the Aerobica. What if you cannot exhale so long, like 2 times the length of inhalation?
That's okay too. So there, I've gone to a couple of clinics, and one of the clinics that I was at, the patient had severe COPD, and they had great difficulty exhaling against the device. Just do what you can. And if today that means that you can only exhale for 2 seconds against the resistance, that's okay. At least you're getting your airways exposed to that positive pressure and the oscillations for as long as you can. If you continue doing the treatments daily, that may improve, but it's going to do benefit for as long as you can. Make sure that you've got that resistance setting down at number 1 so that it's at the lowest possible resistance, and just do what you can.
Okay. So we have some comments and questions about the length of time that you boil the device. You know, in terms of killing NTM specifically, 10 minutes tends to be the recommended amount of time to boil something. Is that something that, you know, the Aerobica, for example, could withstand?
I know for our international instructions, we recommend 5 minutes boiling. For the US, is it the same, Chris and Judy? Is it 5 or is it? Sorry, go ahead.
It is 5, but we know that people are boiling it for up to 10 minutes with good results. It's
Okay.
not in our insert.
Okay. Somebody was asking about the vinegar soaking. There have been a few questions about, you know, what does it actually do? And I've reiterated your point to them that it's actually to remove the mineral deposits that form from the water that's used in the cleaning. But does it leave an odor, the vinegar, or does that dissipate quickly with, you know, the rinsing afterwards?
Yeah, you know, that's a great question. You don't want it to smell like salad. So one of the things is that you're going to dilute the vinegar with 1 cup of water. So it's already a milder solution than just vinegar by itself. But a reminder that that is a soak, and then you would wash it according to using your dishwasher or using soap and water. So you're going to wash it after you soak it in the vinegar. So it should not have any residual smell. The polymers won't pick up the smell of the vinegar.
Okay. Is it best to use the Aerobica before an inhaler morning and evening?
I'll take this one. There are 2 thought processes with it. So 1, I would check in with your care team and ask what way they prefer. But I will tell you both theories, and you can decide, or you can work with your care team to decide. So if you're using an inhaler or you're using your nebulizer separately and you have a bronchodilator that you're using, that medication is designed to open up your airways, and then using your Aerobica after that, after your airways are already open, would further open them. The thought is that maybe you could move secretions that are deeper in the lungs because you've already expanded them, and then the secretions will come up. On the alternative thought process is, if I did my Aerobica first, I would open up and remove the secretions, and then did my neb or inhaler after, then the medication could go deeper into my lungs. So there's no right or wrong answer. A lot of times it's trial and error. What works best for you? How do you move more secretions? Because that's it. With NTM, that's really the goal, is to get the secretions out. So how do you remove more? And then see what your care team advises you on that. So it's not wrong to do either or. Again, the only time we would advise you not to use the Aerobica after is if you took an antibiotic nebulizer, or sometimes you can get the dry powder. Those need to sit in your lungs, and so not doing the Aerobica after that is the best route.
Okay. What about boiling it in distilled water? Is that
So when we initially introduced the Aerobica device, actually all of the cleaning methods required that you rinsed it in distilled water. We made some improvements to the polymers that we use and to the design of the oscillation engine. And so you actually don't need to go to the expense of adding distilled water to your cleaning regimen, as long as you're doing that monthly soak to get rid of any mineral buildup or deposits that could be occurring on the small parts of the device. So no, you don't need to use distilled water.
okay? Can you use the same water to soak your Aerobica in which you soak your saline solution inhaler mouthpiece? Reusing it in this way would save a lot of sterilized water.
Like, would they wash them together?
I would assume so. Yeah.
Or are they soaking it and then covering it and re-soaking?
It doesn't really say. That's how the question was asked. That the person clarified below that it says not all of us use the AeroClip to nebulize. So I guess they're just asking about, I guess, maybe cleaning everything together.
Yeah, it's okay to clean everything together. That's not a problem. Can you reuse sterile water? I don't think so. No. But if you're washing them all together at once, that's fine.
Okay.
It's saving it and then reusing it for the same purpose. You would want to get new sterile water.
Okay. We have a few questions from people about hemoptysis, bleeding from the lungs, when they're using this. Can you comment on that? Should they be looking at maybe the resistance setting? Is there something else that they should be talking to their doctor about? What advice do you have for patients?
So there's a range of hemoptysis. So if you have, this is something I definitely would talk to your physician about. If you have sputum with a little speckled blood tinge in, you're probably okay. If you're actively bleeding while you're doing the Aerobica, then I would not recommend it, and I would talk to your care team about it. So not knowing how much hemoptysis you have, this is a question for your care team.
Yeah, I think anytime you have any kind of blood in your sputum, it's something you need to address with your care team.
Mm-hmm.
Is this mesh technology? Somebody's asking.
So I'm going to assume that's referring to the AeroEclipse, and no, it's not. The AeroEclipse is a jet nebulizer, so it does require an air source in order to create the aerosol.
Okay. Somebody is asking to hear again, how do you combine these when you have NTM? I guess
maybe that's in reference to the nebulizer medications that they can use for combination.
Probably.
So putting it on the back. So you have your Aerobica and you have your if you are using an AeroClipse, you would take off this mouthpiece that has the green exhalation port on it and combined it directly to the back of your Aerobica. And then you would turn on your nebulizer just like you normally would. And the only thing that you would do different is you would change your breathing pattern a little bit to match to optimize for the Aerobica. So if you can keep this in breath actuated mode, that's going to be the best. And then you would try and take that deeper breath in, hold if you can, and then exhale out as active not forcefully, but active and as long as you can. So it should look more like this. Pretend this is running, but you should still do the deep breath in. And then you would, again, just keep repeating, breathe through and exhale out. One other way that I know people who are concerned about breathing through the devices, Aerobika, they will take their nebulizer and inhale and exhale. Inhale. It depends on how coordinated you are.
Thank you. Why does the AeroClips have a valve in the mouthpiece and the Aerobica does not?
Oh boy. Now I'm gonna nerd out a little. These are fabulous questions. So the Aero Eclipse valve on the mouthpiece makes it easier for you to exhale. That's the simple reason. But why it has one and the Aerobica doesn't is because there's little valves on the back of the Aero Eclipse that entrain air into the nebulizer as you're inhaling to help boost the amount of medication that you receive when you're inhaling. When you exhale, those valves close. And if you didn't have the valve on the bottom of the mouthpiece, you would find it extremely difficult to exhale through the device because all of the valves are closed in the nebulizer cup. So the valves on the mouthpiece make it easier for you to exhale when you're doing a nebulizer treatment by itself. If you had those valves on the Aerobica, which you shouldn't, it should be a solid mouthpiece, what would happen is air follows the path of least resistance. So going through the device, going through the Aerobica device, would be the path of greatest resistance. So all of the air would exit through the valve on the mouthpiece. So you want to make sure that you're using the correct mouthpiece with each device. And even when you combine the AeroEclipse with the Aerobica, you're always going to use that solid mouthpiece. You're never going to use this one. Great questions.
Can you just show everybody briefly again where you would attach the manometer to the Aerobica?
Can. So the manometer comes in a separate sealed package, and all you have to do is take the mouthpiece off of it and join the manometer. I should spin it this way. So the manometer would fit right on to the side and then the mouthpiece on here.
So
and you might need to
extender.
adjust this. Pardon?
It acts almost like a mouthpiece extender.
Correct. Mm-hmm.
Okay. Thank you. So what is the concern of some patients with NTM not using the devices together? Are you breathing back in what you exhaled out? Is there any concern about, like, you know, inhaling back in the NTMs that you're exhaling?
On what device, Amy?
It doesn't specify.
I think it's when we were explaining that some people don't want to inhale through the Aerobica device. Why wouldn't they want to inhale?
Okay, yeah.
Yeah. So there's a concern of reinfection, right? So if your device hasn't been cleaned properly, if your lungs are clear from NTM, like if you've gone through the treatment and you're not active, but you have something in the device, everybody's scared. I shouldn't say everybody's scared. People want to minimize what they're inhaling through. And so we've heard that a lot of people won't inhale through their Aerobika if they're doing it like this. So they'll breathe in and then exhale out, and that is okay. If you exhale out NTM and it gets collected in here, there is a chance that you can inhale it. However, it's coming from your lungs, so it's not technically a reinfection at that point, right? The reinfection would come from a device in training in, or if you had, GERD or aspirated some of your stomach content in. So not everybody does that, but I have talked to some people that do not like to inhale through their devices.
Okay. Should my lips cover the AeroClipse green valve when I use it in combination?
No, they shouldn't, because you're using the wrong mouthpiece. So the Aerobica, whether you're using it by itself or with the Aero Eclipse, you're always going to use that solid white mouthpiece, never the one with the green valve. You'll only ever use the Aerobica with this solid mouthpiece.
Okay.
But if you are just using your nebulizer, no, you do not want to cover those valves.
No. You'll have trouble exhaling.
Mm-hmm.
Yep.
Inhaling with the Aerobica, I guess this person's asking, what's the difference between through the Aerobica and not through the mouthpiece?
There's no difference unless you have your nebulizer connected. If you have your nebulizer connected to the back and you're not inhaling through it, you're not going to get your nebulizer. But to do the Aerobica, if you don't breathe through it, if you take your breath in and then breathe through it, that's absolutely okay. We've allowed it, again, remember the airflow comes in from this way, and then when it comes out, it goes through the device. So as long as you are exhaling through the device to get it fluttering and to get that positive pressure, you're okay.
Okay. How long is the Umbra nebulizer good for?
So the Umbra and the nebulizer have two different replacement periods. The Umbra compressor is good for 5 years, and the Aero Eclipse XL nebulizer is good for 6 months.
Okay. So we have a number of questions about where you purchase these things and how. Mm-hmm. I'm just going to start going through the list and reading out those various questions. Where do I purchase tubing and Eclipse or new Aerobica in the US?
So it would depend on the state that you're in, but if you contact our customer service team, they would be happy to send you to a place where you can redeem your prescription.
Okay.
Yeah.
As a respiratory therapist, I hear from patients that their physician didn't order a valve holding device when they prescribed the inhaler. What do you recommend these individuals do to obtain a spacer?
Yeah, that's a good question. If the patient is in the United States, it does require a prescription in order to obtain a device. So they would need to contact their care team in order to do that. But for other markets, David, do you want to chime in?
Yeah, for Canada, well, often it is prescribed. I believe AeroChamber is also over the counter, so you can purchase it from your local pharmacy. Most local pharmacies should carry the AeroChamber, as well as the Aerobika in Canada, though. In international markets, it does also depend. But in Canada, Aerobika and AeroChamber are both over the counter, so you can purchase it in local pharmacy or have it prescribed. Yeah.
Okay. Does insurance cover the cost of the devices, or can it cover the cost of the devices generally in the United States, or is it totally an out-of-pocket cost?
Ooh, that's really going to depend on your insurance.
But it is possible for somebody to cover it.
It's possible.
It just depends on their insurance. Okay.
Yeah.
I am going to scroll down because there are some other questions about this that I think are important to touch on. Hang on one second, let me find those. Okay, what about Aerobicas offered on Amazon?
So in Canada, as I mentioned, the Aerobica is over the counter, so it's not, you don't need a prescription. You need a prescription if you're submitting for private reinsurance coverage in Canada again. But because it's over the counter, as I mentioned, you can buy from pharmacy or Amazon.ca, so the Canadian Amazon webpage. We do also have the Aerobica available there, so you can purchase off Amazon. No prescription is required in Canada. Hopefully that answers. Yeah.
Okay. So yeah, in the U.S., those are not preferred or accredited sites to. They're not approved to be selling the Aerobica.
And the challenge with you know, the resellers on eBay and Kijiji or Craigslist, we've had patients who have purchased them this way, and you don't need a prescription if you're buying them off of these resellers. But when the patients receive it, they may be open. The devices, there's no way of knowing if they've been used previously and then just refurbished. So we do recommend that you go through the regular channels and not buy from a reseller.
Okay.
And maybe let me add on to that for the Canadian perspective for Aerobica. So while there may be different resellers on Amazon, Amazon.ca Canada, the brand should be the Aerobica brands for Amazon. So that is fulfilled through Trudel Medical International. And also it is still recommended, although it is over the counter, that you can still speak to, and you should still consult with your care team or your physician if you have any questions about device use. Of course, you can always reach out to customer service, but sometimes it's better to consult with your physician if you're unsure about how to use the device. So I just wanted to make sure that I reinforced that.
Is the Aerobica available in the UK?
It is available in the UK. So it's not over the counter in the UK, it's prescriptions. So yeah, like I said, it gets very, very confusing, but it is available in the UK. I would either talk to your healthcare provider. You can reach out to Trudel Medical International customer service on the Trudel Medical International website. If you scroll to the bottom, there is a customer service number as well as the email address. And you can always submit an inquiry there and we'll get back to you. Yeah.
And we'll make sure, Amy, you have information about all of this, that we send it to you so that it can be clear.
Yeah, I have a feeling it's going to be a very long FAQ that we get out of it.
I love it. I love it.
I use UV baby bottle sanitizer, a UV baby bottle sanitizer for disinfection. Is that okay?
Right now in the United States, UV disinfection is not approved by the FDA. So we cannot advise to do that.
Okay. How often should I boil the Aerobica parts? Should I do it after every use, or they're asking how often they should boil the Aerobica parts?
Yeah, so for disinfecting methods, it depends. If you're concerned about reinfection, then disinfecting once a day is perfectly fine. Most people will find that they don't need to disinfect that often. They might resort to a once a week schedule, but these class of people or patients may not be as sort of concerned with infections, but it can definitely be disinfected once a day. So boiled once a day If concerned about possible infection or reinfection, it's completely fine.
Okay. How about nebulizer tubes? How often should those be replaced?
You know, that's really going to depend on your care team. I know there are different clinic facilities that will recommend that tubing be replaced weekly or monthly. The tubing that comes with the Aero Eclipse XL is also good for 6 months. But if your care team has recommended that you replace it more frequently, then their instructions will always override ours. The tubing cannot be cleaned. It cannot be submerged in water. You can only run a tissue dipped in isopropyl alcohol down the outer surfaces. It should never be submerged in water or cleaned. So I would ask your care team if what their instructions would be.
Okay. Is the Aerobica harmed by baby bottle sterilizers or by that sterilizer bag, I guess, that people use?
So it shouldn't be have any harm from using an electronic steam sterilizer like a baby bottle sterilizer. In Canada, in the international markets, we do recommend that as actually the recommended disinfection method, although the US does deviate from that where it's not FDA cleared. So it's kind of a tough question to answer, but it shouldn't damage or cause any damage to the Aerobica device.
Are there any precautions to take when using the Aerobica with respect to eating? Are there ways to prevent food particles from being aspirated and then getting into the lungs other than brushing your teeth? That's a good question.
Yeah, we would recommend that you don't use your Aerobica immediately after eating, especially if you haven't cleared the food particles from your mouth. Most often they go into the device and they don't end up aspirating into your lungs, but you can get debris stuck in the device that can be hard to shift out of there with normal cleaning processes.
Okay. Should you use the nebulizer prior to the Aerobica or vice versa?
That goes back to how the question I answered previous. There's the two thought processes, and using it before or after is acceptable. I would talk to your care team to see what they recommend, and then I would check what works best for you to remove the most amount of secretions. Again, if you're doing an antibiotic neb, that should always be at the end of your Aerobica so that you're not displacing that medication from your lungs. It's staying in there as long as possible.
Okay. What is the recommended method if you are using the Aerobica with AeroClips and nebulizing both liquid albuterol and sodium chloride solution?
My recommendation, and again, I would talk with your care team provider. Sometimes the sodium chloride, the hypertonic, can be irritating to your lungs. We actually used it to induce a sputum sample in your lungs. So some people it can cause bronchospasm. And so doing your bronchodilator before that and then your hypertonic after is preferred. But again, check with your care team to make sure that's how the order that they want you to use them in. They should never be mixed together in the neb cup though. They're different buoyancies and consistencies, and you won't get the equal distribution into your lungs.
Okay. If I use 2 nebulizer tubes and 2 Aerobicas, can I extend the life of them to 1 year?
So the Aerobica device is good for a full year. And the nebulizer is good for 6 months. So if you have 2 nebs and 1 Aerobica, you're good for 12 months.
Okay.
Yep.
My Aerobica is over 12 months and still works fine. What's the risk to use the Aerobica more than 12 months?
Oh, these are great questions. And again, I'm going to nerd out a little. So when we put a lifespan or a recommended replacement period on our devices, what we need to do is show our regulatory authority that we have done validation testing to ensure that the performance of the device is the exact same on day 1 as it is on day 365. So we make sure that we test even just a little bit longer than the 12 months to make sure that the device performance doesn't change. We haven't done testing past that point. So all we know is how the device, or all we know is that the device performance won't change over that 12-month period if you're using it every day, 4 times a day, and cleaning it and disinfecting it every day. So that's what we can say. If you're using it past the 12-month period, chances are you haven't used it for everything that we've tested for, but we can only say the 12-month period.
Okay. And to clarify for people who are listening, when you say regulatory authority, these are regulated as medical devices by the FDA.
That's correct, yes. In order to be able to sell in the United States market, we had to go through the 510K process with the FDA and prove the safety and efficacy of the device for its intended use.
Okay, thank you. Will the Aerobica withstand boiling for 10 minutes every day and still last 12 months?
We have it as sort of as Chris alluded to, because our boiling recommendation is 5 minutes, which should be okay. I can't for sure say that boiling 10 minutes would result in the same lifespan. We don't unfortunately have the data or have conducted that testing. So I can't give an answer that I'm fully certain on. Yeah, unfortunately.
Okay. Somebody's asking about a particular segment. They'd like to review that segment where you talked about when to use the Aerobica white mouthpiece versus green AeroClipse mouthpiece.
Sure. So the green Aero Eclipse mouthpiece, the one with the valve on the bottom, should only be used with this device, only be used with the nebulizer. The purpose of it is to allow you to exhale when you're using the nebulizer because the valves close off, right? If you used the solid white mouthpiece with the Aero Eclipse nebulizer, it would make it next to impossible to exhale through the device. So you need those valves in order to make exhalation easy. Whenever you use the Aerobica device, whether you're using it in combination with the Aero Eclipse or you're using it by itself, you always use the closed solid mouthpiece. You will never use the valved mouthpiece from your Aero Eclipse with this device. And that's because the air is going to follow the path of least resistance, which means if you have the valves on the bottom of the mouthpiece, your exhale breath is going to go outside of the device and not through the mechanism, which is going to create the pressure and oscillations in your airways. So you never use this mouthpiece with anything but this device. Okay. Not even if you combine it with this one. You always use a solid mouthpiece with the Aerobica device.
Okay, thank you. Regarding the huff cough when using the Aerobica, how many times should they do the huff cough? Should they do it just once or several times?
I would suggest trial and error. One time is probably not going to do it, but what you don't want to do is work so hard on the cough that you are exhausted and can't finish your therapy. So 3 to 6 times is usually what people use. And a lot of times you will know if you've cleared or if there's something stuck in there where you may need to do 7 or 8 huff coughs to get it out. Some people will do kind of an autogenic drainage, like with a breathing, where they progressively try and bring their mucus up and then huff cough. So whatever will work for you. But 3 to 6 times is usually what we recommended in the hospital, not what Monaghan recommends.
Okay. Somebody is saying their Aerobika device came with a mouthpiece that has a green mesh on it, and they need a solid white mouthpiece for the Aerobika. How do they obtain one?
Okay, so what probably happened is it got switched out with the AeroEclipse mouthpiece at some point, because the device will always come with the solid mouthpiece. So contact our customer service department, and they would be able to send out a solid Aerobika mouthpiece for you as a service item.
And can we get the customer service number? Maybe we'll drop it into the Q&A for people to see.
Yes, absolutely. I'll grab that right now and throw it in the chat.
Perfect. Thank you. Okay, so somebody's asking, just for a quick repeat, when do you use the mouthpiece with the green valves? It's with the AeroClips.
Just with the AeroClips.
Just with the AeroEclipse. Mm-hmm. Okay. The Aerobika.
You'll know if you have the wrong mouthpiece. If you put the wrong mouthpiece on the Aerobika, it won't flutter. And if you put the wrong mouthpiece on the AeroClips, you can't breathe through it.
Okay. Can you replay the 3 breathing scenarios?
Yes. Do you want me to do that, Chris? Or are you off?
I am just finishing me. And David, if you want to paste in the Trudel information as well.
Yes. Where are you pasting it, Chris? Are you just putting it in the chat?
I'm going to put it in the chat. Yes.
Okay.
I don't think they have access to the chat.
Oh,
no.
Okay.
I'll pull it into customer service. Do you want to play the videos?
Sure. So.
One thing I will tell you that we didn't show you in the examples is you can put your Aerobika like a hamburger, like this, if you're doing combination therapy. It doesn't have to be upright either. Okay, go ahead.
Okay, so I'm going to scroll back up. Okay, so the first one we're going to cover is the correct exhalation technique. So this is the one that you're going to want to use most of the time, and you'll notice that the red plunger stays within the green zone of the manometer, and it's very consistent throughout Judy's exhalation effort. So here is what the exhalation should sound like. I'll just play it one more time. If your resistance is set too high, it's going to make it difficult for you to exhale through the device. So this is what it would sound like if the resistance is set too high. And you'll notice that the red plunger is barely visible when Judy's doing it. So you would want to move that resistance indicator down to a lower number to make it easier to exhale against the resistance. If you have the resistance set too low or you're exhaling too actively, this is what it's going to sound like. And you'll notice that the red plunger goes into the yellow and red zone, and there's sort of an odd sound coming from the device. So this is what you definitely want to avoid. And we're going to be sharing this PowerPoint with Amy afterwards as well, and we can make those clips available.
Great, thank you.
Yeah.
Okay, this was another question about using the nebulizer first and then the Aerobika. We answered that. After boiling the breath-actuated Aero Eclipse, how can you be sure the inside of the top screw-on piece is dry before you use it next?
So the materials that are used in the top part of the Aero Eclipse are silicone polymers, and they're naturally water repellent. So if you are shaking out the top of the nebulizer and then leaving it to dry either like this or like this, the water is going to, it's definitely going to dry within that area. There's good airflow because of all the vents.
Okay. For those of us with NTM, we need to do this double fisted. So inhale through Aero Eclipse with the valve mouthpiece, hold for 3 seconds, exhale through the Aerobica with the non-valve solid mouthpiece. Is that the correct summary of what you were showing earlier?
Correct.
Okay. I produce a lot of saliva when nebulizing. It gets mixed with the medication in the nebulizer and creates a foam. Is this a concern? Is this something they should be concerned about?
That, honestly, that sounds like a question for the healthcare team. I don't think that's something that we can address, really.
Would it be a concern in terms of the device itself, like damaging it?
No.
Okay.
Yeah.
No, actually on the Aero Eclipse, there is kind of a drool catcher. If you look in here, so if you're producing a lot of saliva and it runs back, it should actually come out your exhalation valve on the device as well.
Okay. Somebody is asking, they're saying, I use the Pari nebulizer. Is that an okay substitute for the Aero Eclipse?
No. I'm teasing. Yes, absolutely. Whatever you have, whatever nebulizer you have, we sell the AeroClips, so that's what we can speak to. But the Pari nebulizer is great as well.
They're different devices, though. So,
yes.
do I need to rinse the components under running water prior to soaking it in soapy water, or can I just throw those components into the soapy water right after I use them?
I mean, if you're talking about the Aerobika device, just disassembling it and putting it into the soapy water is fine. If you're talking about use with a nebulizer, I would empty the, if there's any remaining liquid in the cup, I would empty it into the sink and then wash the nebulizer. But that's just personal preference.
How long do you use the Aerobika each time?
So again, it's variable, usually between 10 to 20 minutes per session. Although it'll depend, and it's sort of best to talk with your care team about that and sort of factor in if it is more of a tiring experience, then it might be closer towards that 10 minutes. But if you can, otherwise, then it could be in that higher range towards 20 minutes. Usually, though, that range is between 10 to 20 minutes we recommend per session. But as I mentioned, it can vary for each person.
Okay.
Depending on your condition or where you're at in your process, maybe if you usually use it, let's say 20 minutes twice a day, and now you're having more symptoms and it's too tiring after 10 minutes, you can chop it up. So if you still want to get back to those 20 minutes, you can do it at different times of the day if you have time to do that.
Okay. Next up, it takes me 30 to 40 minutes to finish my saline using an AeroClips attached to the Aerobika. Do I need a newer or stronger compressor?
Wow, that's a long time. We often get questions about which types of compressors can be used with the Aero Eclipse nebulizer. And what I will tell you is that the reason we sell the Umbra is because the Aero Eclipse is really tough on compressors. The way the nebulizer works, the airflow comes in the stem at the bottom and it's forced through a tiny orifice, which causes tremendous back pressure through the tubing and on the compressor motor itself. So we've designed the Umbra compressor to compensate for that. And so if you're using the Aero Eclipse with a compressor that is other than the Umbra, it could take longer to do your treatments because the pressure that it is able to create while overcoming the back pressure coming from the nebulizer itself would be lower, which will extend your time. The other thing is to make sure that you're taking those nice deep breaths in, because the device is only going to create aerosol when the green feedback button is down. And so you want to make sure that you're not stopping your inhalation prematurely. But you would need to look. We offer the instructions for use for the reusable Aero Eclipse on our website, and you can check the pressure requirements there and see if they match the compressor that you have at home. So I see there's a question specific to another brand of compressor, a Philips compressor. And certainly it's designed to work with their nebulizers. And so the Aero Eclipse may be tough on those other types of compressors.
Okay. Is it okay to spray alcohol into the Aerobica pieces after use to help with the drying, or better to have 2 Aerobicas, one for the morning and one for the second daily treatment to be sure it dries?
In terms of spraying alcohol, I'm not sure about that. I'm not sure if you know, Chris or Judy, but if you're using it in the morning and then in the evening, after you wash it, if you shake it out gently to remove a lot of the collected water, it should, in most cases, be dry for your second when you're going to use it again. I'm not sure to the first point in that question, though.
Mm-hmm.
Okay. Could you use a regular stovetop vegetable steamer with a basket that sits above the boiling water for sterilization?
So I think we would prefer that the vegetable steamer be in the pot and the pieces submerged in the water, just to make sure that you're getting the full benefit of the temperature of the water to clean it, rather than just the steam. But a steamer basket is a great idea because you want to make sure that these parts and pieces don't touch the bottom of the pan, because that's where it's the hottest point. And if they stay there too long, it can warp the parts. So using something in a pan like a vegetable steamer, but submerging the parts fully in water would be a better plan.
Okay. And presumably don't cook the vegetables at the same time.
No.
Somebody's asking about a lumen machine to disinfect and clean. I just looked up a lumen machine. It's a CPAP sterilizer, and it looks like it uses UV. So I would assume the same rules apply, that UV sterilizing has not been tested for sterilizing these particular devices.
Correct.
So for how to clean the Aerobica, soap and water daily, vinegar soak monthly. How often should you disinfect?
Again, disinfection can vary. For if you have NTM or even patients with cystic fibrosis, sometimes it's better to have a more regular disinfection schedule, such as once daily. Otherwise, if you're not too concerned about disinfection, then once a week is perfectly fine.
Okay. And if the Aerobica is working fine and it's in good shape, why toss it after a year?
Again, sort of to Chris's comment before, it's what we have it validated for. So we have validated for 12 months use based on the cleaning and disinfection options that we outline in our instructions for use. So after that, we can't say with certainty, just because we only have it validated up from day 0 until day 365, that the performance is similar between them or the same. So it essentially comes down to what we have it validated to based on cleaning and disinfection schedules.
Okay, thank you. Can you add the manometer to the Aerobica that doesn't have one? It's just, I think, Judy, you had already demonstrated this. You're just removing the mouthpiece and putting the whole manometer piece on. It's like extending the mouthpiece. So the answer to that question is yes. Yes, you can.
The one thing with that is that the manometer isn't provided separately, at least I believe it's the same in the US. So it would be prescribed in the US with an Aerobica device. Likewise in Canada, it's not sold separately though.
Okay, yes. I have been doing airway clearance. I have never had the release of mucus after doing a huff cough. Can this happen? Yes, it can. Is the answer. Yes, it can. Different airway clearance methods work for different people. So, but it doesn't mean it's not helping somehow. So this may have been asked since they missed the beginning. Can you provide a list of other nebulizers that work with the Aerobica? Do you know, is there a list somewhere of nebulizers that are compatible with the Aerobica?
Yeah, all nebulizers should be compatible with the Aerobica. It's finding the right adapters to get it connected. And so if you have a respiratory therapist, they can gladly help you with that. Most of the T nebulizers that are out there can connect right onto the back. But it is a standard ISO fitting, a 22 millimeter. And so if you can find the right connector to put on there, you can use it with any nebulizer.
Okay. What is the...
Oh, sorry, Amy, I'm just going to jump in. I actually have to jump off the webinar, but I want to thank you for inviting me to present and to answer some questions. It was a great experience, and hopefully I was able to share some insights that are helpful for certain people. So thank you again.
Thank you, David.
Yeah, have a great day, everyone.
You too. All right. I guess we will keep going. We still have questions to answer.
Yeah.
What is the we have at least 40 more. What is the difference between tandem therapy and combination therapy featured on the Monaghan web pages?
Wow.
I love this. So combination therapy, as we've been talking about, is the combination of the Aerobika device with the Aero Eclipse, so that you can do your nebulizer therapy and OPEP therapy at the same time. But tandem therapy is something very specific to the hospital. It would be used if you were having trouble with collapsed airways and mucus retention, maybe post-surgically. It uses a different device combined with the Aerobika device. It uses a positive airway pressure that uses supplemental airflow to create, well, really, Judy, it helps keep the airways inflated on inhalation and exhalation.
Yeah. It's kind of a boost on your inspiratory side. So what it does is it pushes air in when you take a breath in. And when you exhale, you still get that positive pressure and the vibrations from the Aerobika. So it's more of a supportive mechanism to help open up collapsed airways and then help with your the breathing in and out, CO2 removal, and oxygenation.
Okay. But it's not available at home.
Yeah, we don't want you doing it at home.
Nope.
So we have a question about availability and durable medical equipment providers. Apparently this person can't get the Aerobika through any of the DMEs within their network of health insurance. Will it be available? Will the Aerobika be made available to DME providers nationwide? And
so this is a tricky one. The coverage that DME providers have is done through an agency that requires devices now have a 3-year lifespan in order to qualify for reimbursement. And the Aerobika we launched with 6 months replacement, and we've been able to move to 1 year. But at this time, we just were not able to meet the threshold of the 3-year replacement period. So we're stuck there, unfortunately.
If you, however, if you contact our customer service at Monaghan Medical, they may be able to help you source or find where you can get a
device.
Mm-hmm.
Okay. Next up, we have, I started getting severe neck tension when using the Aerobika, and it caused pain in the back of the head, not migraines. Oh, they're making a note that stretching and strengthening exercises help with that. Thank you for letting us know. That's very helpful. And another question about how many huff coughs before you continue with the breath. You had said total. Judy, can you reiterate how many huff coughs?
Yeah, I would say 3 to 6, but depending on the day, you may need more. It's really finding what works for you. Most people that I know, 3 is the absolute minimum to move secretions, but they will do upwards 3 more to 6 more typically.
Okay. Next up, a question about vinegar. What percent vinegar, for example, 4%, 8% or higher, would 4% vinegar work?
Yes, I think the vinegar that we used during our validation testing was just standard off-the-shelf white vinegar from the grocery store, so nothing special. But I would think that either would be fine because you're going to dilute it with a little bit of water. So use whatever vinegar you have.
Okay. Please show again the 4 parts that get washed.
So the Aerobika device disassembles into the mouthpiece. Again, not with the valve. Then the top case comes off by pressing the 2 side levers. and that is the second piece. The inner cartridge is the third piece, and it does not get disassembled any further than what you take out of the device. And then the bottom case is the fourth piece.
Okay, thank you.
Not enough hands.
Here, okay, so is baby bottle steam sterilization acceptable for both Aerobika and Nebulizer mouthpiece?
Right. So I see that they received the device back in 2016 with that instruction in it. So let me explain. When we launched the Aerobika device, our initial FDA clearance did allow us to have that electronic baby steam sterilizer in the instructions for use. However, when we went back and submitted the application for the manometer accessory, they deemed that the baby bottle sterilizer was off-label use, so meaning that it's not intended to clean medical equipment, and so they made us remove it from the US insert. So although the validation testing has been done, and it appears in all of the product inserts outside of the United States, in the United States, we had to remove it because the regulatory guidance at the time said that it was unacceptable. So will it hurt it? No. Can I recommend it? No. But if you found the instructions on the Canadian website, or asked a Canadian friend, then you might be able to know how to do that.
Okay. Okay. Can you use vinegar every time you soak the Aerobika?
I don't think it's necessary.
Again, the vinegar is not used for sterilization. It's used to clean mineral deposits from the water, so it's not needed.
Yeah.
Has anyone written a handbook with these directions for each device and tips for NTM airway clearance? I've been unable to produce a sputum sample for the lab analysis. Well, with respect to the airway clearance, we have actually had a couple of webinars on this, and you can find them on our YouTube channel, and we have information on ntminfo.org. With respect to directions for the devices, I'm going to let Judy and Chris speak to that.
Yeah, so we've just recently updated our website. And so if you go to monaghanmed.com and you go to the Aerobika device page, you will find instructional videos on how to use the device, how to clean it, how to use it with the nebulizer, or how to use it with the manometer. We also have a YouTube channel. And if you are in any other market outside of the United States, you would go to the Trudell Medical website, and they have similar videos on how to use, how to clean, how to use with a nebulizer. And so we'll make sure that Amy has those links.
Okay, thank you. For the monthly vinegar soak of the Aerobika, should it be regular water, distilled, or boiled?
It can just be regular water because you're going to clean and or disinfect the device after you soak it. So the monthly vinegar soak is not a cleaning method. It's something that you would do once a month before you clean the device. So, yeah. Great.
Somebody's asking about the advisability of using the Aerobika in combination with a vest. Is this okay or is it overkill? I would say depends on what your doctor has prescribed for you.
We actually have worked with a lot of patients that use it together, and that's what works for them. So it's not right or wrong. It's what works for you. It's finding that right combination with everything.
Okay. We have a follow-up on the question about the DMEs and the requirement that devices have a 3-year lifespan. And DMEs offer nebulizer kit replacements, and those only have a lifespan of 6 months.
Right, but it's the compressors that are covered, not the nebulizer unit. Yeah.
So somebody's commenting they have bouts of unexpected coughing because of insufficient airway clearance, but the Aerobica causes gagging and excess coughing as well. Do you have any suggestions on how they could manage that while they're doing their Aerobica treatment?
The only suggestion I have, and I've worked with one patient with this, and we started by taking it down to the lowest resistance level and working up to her appropriate resistance level over time. So that was the only thing. I don't hear, I know that there's a couple questions about that on here. I would just recommend working with your care team. If you can't get through the Aerobica or get to the right resistance level, maybe your care team needs to look at a different modality for airway clearance for you to be able to do that, unfortunately.
Somebody is commenting that some of the doctors want patients to use the Aerobica in 3 or 4 different prone positions in order to target different lobes of the lung more effectively. So I think if there's a nebulizing to be done, if there's any liquid in a cup that's attached, it would be more challenging. I guess they would do that separately then, the nebulizing separately from the Aerobica.
Well, it's kind of a catch-22, right? So secretions are gravity dependent, and they will move out of the lobes based on how you're positioned. So if you are prone to a right upper lobe, or let's say a middle lobe collapse from secretions, they might want you with that lung segment up on your side. And if in that case, the Aerobica, even if you're using it with the nebulizer, it is position independent. And so a lot of devices, may claim that, but they're not truly independent as the Aerobica is. And so that is where, if you can turn your Aerobica onto its side, so if you're laying sideways and you can do your Aerobica like this so that your nebulizer is still up and down and you can do both of them together, it would be super hard to do it in a prone position. And that's where, if you can't position the device so that this remains straight up and down, you don't want it tipping, then I would say disconnect, just do the Aerobica, and then when you can get to a different position, you can put it back together. That is, I don't want to say an extreme use, because your physician or your care team is asking you to position for better airway clearance, and that's what you should follow. For most everyone, though, the Aerobica will provide good clearance just upright and sit in an upright position. It works better when you have an open airway and you're not like slumped over in your bed or halfway seated down. Airway clearance is an active maneuver, and so the better your posture, the better your breathing, the better your technique, hopefully the more secretions you'll be able to remove from it.
Okay, thank you. Sometimes I have liquid coming out of the Aerobica when combined with the AeroClips. Is this normal?
Yes. So the aerosol that's coming through the combined devices even if you have it in breath actuated mode, there's going to be some medication that gets exhaled, and so it will go through the device. And depending on how long you're doing your treatment for, that combined with the moisture that's already in your exhaled breath can collect in the bottom of the device. And so that's perfectly normal.
Okay.
And it'll be more if you have the nebulizer in continuous mode. So.
Okay. When combining the AeroEclipse and the Aerobica for your 7% saline treatments, would the saline damage your Aerobica?
It will not damage the Aerobica, no. What you will notice though is that you're going to want to clean your Aerobica after that treatment, after that combined treatment, because it is a very sticky medication. So the intricate pieces of the Aerobica need to be washed after you do a combined treatment.
Okay. How often should you change the filters for the Umbra?
So the Umbra compressor filters, really what those are doing is they're protecting the health of the motor in the compressor. So that air is recirculating around inside, cooling down the parts that are creating the pressure in the tubing. The air filter should be changed, I believe, according to the instructions, it should be changed every month. But unless you're, doing a renovation in your house, chances are the majority of the houses that we live in today, you can go much longer. So when you take the filter outlet and open it up, if you look at the filter and it looks yellow or gray, you're going to want to replace that filter. I have a filter in my compressor and I replace it about every 6 months. And I've known people to leave it for up to a year. So.
Okay, next up. Can you cut the tubing in two to get twice the use out of one tube, or does it have to be the original length?
It has to be the original length. And the reason is because the connector can't be connected to the tubing if you cut it. It's attached with like a surgical glue. And so it would damage the connector and it probably wouldn't connect very well.
Okay. And along the same line, somebody's asking, can they use tubing from another device like Parry with the Umbra nebulizer? They can't get the tubing separate from the AeroEclipse XL. Can they buy just the tubing?
Yes, the tubing is available. Again, I'd have to refer them to the customer service line to find out where they could find a retailer in their area.
Okay, great.
And the tubing doesn't need a prescription. The replacement tubing, you can just buy that.
Okay. Flutter piece in my Aerobica melted when I used the bag to sterilize it, and they only sterilized for 3 minutes. Do you have any idea why that might have happened?
Yeah, for sure. So every microwave has a different power level, and the amount of time that you are to put the devices in the microwave will vary depending on that power level. The other thing you need to remember is that each of those, according to the manufacturer's instructions, there will be some water that you need to put in the plastic bag. So it sounds as though you have a more powerful microwave than you maybe timed it for.
We also have noted that some microwaves have hot spots in them, and that can be problematic for the sterilizer bags.
Mm-hmm.
Somebody is asking, why do you recommend using the Aerobica when you are using the nebulizer device?
Just a time saver. We have done the studies to show that the medication distribution into the lungs is the same with the nebulizer alone as it is with going through the Aerobica. And so because we know you're all busy and these treatments can be lengthy and time consuming, being able to combine them is beneficial to you to save time.
Okay. The bacteria I'm infected with is in dust. We live in a very dusty place, which is in the house as well. How can I keep dust off my devices when they're drying?
Ooh. You know, that's a really tricky one, right? Like, the only thing I could suggest is maybe placing a tea towel over top to try and minimize the amount of dust that would settle. You still do want to make sure that there's airflow to allow the pieces to dry. I would say shake them out really well to try and minimize the amount of time that they have to dry for. I don't know, Judy, do you have any other suggestions?
We had this is a patient recommendation, and those clear shoebox, like Rubbermaid. I hate to use the Rubbermaid term, but the clear shoebox covers. If you have your tea towel on the counter and you have shaken out and you're drying them upright, to flip one of those clear covers over the top, there's still air movement. It's not a tight seal, but it keeps the dust off of your devices, but still allows air movement. So a little bit different way, but either way will work, to put a towel over the top or to put the cover over the top.
Okay. Using the Aerobica, should you just exhale comfortably and stop, or continue exhaling until you get all the air out of your lungs that you can?
Yeah, we don't want you to force out all the air, not like a breathing test. We want you to exhale to a comfortable level. If you can go a little bit longer out, but not push it to the very end where you're like struggling to get the air out. So to a comfortable level.
Mm-hmm. Actually, exhaling too far can be detrimental to airway clearance, because you can actually collapse some of those weaker airways. So don't stress yourself too much. Active exhalation, but definitely, like Judy said, it's not a breathing, you know, when you go and have to plug your nose and do your breathing testing.
Okay. Does short tubing allow stronger pressure to the Aerobica?
So I think they mean the Aero Eclipse, because the Aerobica doesn't use any tubing. It's just the device by itself.
Yeah.
It really, it's not to do with the length of the tubing. That it is. It has to do with the power of the compressor and its ability to overcome the back pressure that the nebulizer is creating. So.
Can a portable compressor be used?
Again, you would have to check the pressure output of the portable compressor to see if it's powerful enough to run the AeroClips. I would say, I know in the international markets, we do have a portable version of the Umbra. It's not available in the United States, but treatments do take longer with the portable compressor because they're so much smaller and the motors are a little less powerful. So treatments will take slightly longer as well.
Okay. What is the harm of using the Aerobica or nebulizer if they have not completely dried after sterilizing?
There's no real harm to it other than you just run the risk of getting, I mean, it's just not dry. So when you're using your Aerobica, you can breathe through it and dissipate some of that water that is in there. AeroEclipse, you would add more content into your nebulizer cup.
Okay. Somebody is asking about, they said, thank you for the answer regarding the T-piece. What about the corrugated tubing? What does that do?
So this is a nebulizer question. And so the corrugated tubing goes on the back of the T-piece when you're using it by itself. So it would be the nebulizer attached to the T-piece, and then the corrugated tubing would come off the T-piece. And really that's an older style of nebulizer. And the reason that they do that is because they want the exhaled breath directed away from the face and eyes. So they added the corrugated tubing to extend it away from the face.
Okay.
Because there isn't a way to get it away from.
Got it.
Yeah, it also acts as a reservoir to trap medication in there. So depending on your T-piece, you can connect it directly on. You can connect it this way as well, but it's going to be kind of floppy, so I wouldn't recommend that. I would also not recommend taping the end of it, which some people will tell you to do. Even if you don't want to use the tubing, I would not tape the end of this. Just you're going to lose medication, and that's okay.
Can we get Umbra filters from your company? I think I get them from somewhere in the South. So where would they get those filters?
Yes. Once again, just contact our customer service team. They're amazing. And they'll be able to put you in touch with somebody who has the parts that you're looking for.
Okay, great. If you do postural drainage first, do you sit up for the Aerobika part or stay in your position?
I'm sorry, what was that?
If you do postural drainage, if you're doing postural drainage, do you use your Aerobika first or do you stay in position? Like, do you sit up? Do you stay?
Yeah, you can do either. You can use it in your postural drainage position if it's comfortable for you, or you can postural drain and then use your Aerobika if you have the time to do that.
Okay. And if you cover all the parts with water, why can't you use an Instapot?
So if you're using the Instapot just to boil, that's one thing. But what I can't recommend, because we don't know what's going to happen, is the pressurized use of the Instapot.
So don't use the pressurized part.
Yeah.
Well, we are coming up on 4:30. We're at 2.5 hours and we have answered all the questions. If we have any more questions that are sent to us, we will certainly get those to you. But I want to thank you again for taking the time. This was a wonderful presentation. Everyone, thank you for joining us today. The recording will be available in a few weeks. And in the meantime, we'll be sure to get the customer service contact information out to you. Thank you again for joining us. It was a wonderful afternoon. We really appreciate it.
Thank you.
Yes, thank you for the opportunity.
Thank you so much. This was great. Everybody seems to really have enjoyed this. All right, everybody, have a wonderful day, wonderful evening, and we will see you soon.